Particular, I think there's a lot of funny moments because
Benvenuti sul canale GarfaWellness, questa è la prima puntata. Io sono Federico Rocchiccioli, fisioterapista e osteopata. Se vi va di seguirmi iscrivetevi e attivate la campanella per non perdere i prossimi video. Oggi sono contento, molto contento di iniziare questo video con Makayla. Hi Makayla, welcome.
Hi, thank you for having me.
Who are you and why we are in Garfagnana?
My name is Makayla. I am a student at the University of the Incarnate Word in San Antonio, Texas. And for my last rotation, I came here to do an internship for 3 months.
What were your expectations when you arrived here and how it changed after 3 months?
Sure. My expectations when I first came here were to be able to be flexible and relaxed because I knew I was going to a place where I didn't know the language, the culture, so tried to be very open-minded. And when I was here, I knew it was a small clinic, so I thought there wouldn't be a lot of patients. I thought it would be more slow, less patients that are seen. However, over the 3 months that I was here, it definitely was not like that. It's a very busy clinic. Yes, there are some slow days, but for the most part, we see lots of patients, lots of different types of patients, all types of conditions we see here. So very broad for this of a small of an area.
And during your 3 months of internship, there was a moment where you think, whoa, it's a special to stay here.
Oh yes, every day there's something that I see here or a patient or even watching you or another part of the team do either manual therapy or some type of exercise or some type of specialized treatment where I kind of fall in love with this area and this clinic, and it makes me want to stay here.
Okay, thank you. Do you remember if you find that there is unusual with the patients?
Like an unusual condition?
Or no unusual condition, unusual approach with, we are in Italy, we are a different culture.
Yes. So I think one that was kind of interesting to me was with Lucia. She does pelvic floor therapy here, and I had learned about pelvic floor in school, but hadn't seen a lot of the treatments done. And so seeing her approach to things with pelvic floor conditions was very eye-opening because it's not just black and white, and she really adapts to the patients. And so she would tell me, a patient comes in and I really need to see them and be hands-on before I even make an approach because I'm going to change my treatment for each patient. And I thought that was really neat how she makes sure that she specializes each treatment.
During my evaluation, you say to me that in USA it's not usually take off the wear to the patients.
Correct. So a lot of times in the States, at least the clinics I was at, not speaking for everyone, but a lot of the clinics, patients will remain with either a t-shirt on or their pants on, which to be honest makes it kind of difficult because when you're trying to look at a patient with a musculoskeletal condition, you need to be able to see the skin or the bones. Yes. So I thought it was really good that you changed that approach to maybe the patients here are more comfortable with that.
And you remember some funny moments with the patients?
Not one in particular. I think there's a lot of funny moments because many times the patients don't know I'm American, which is surprising, until they tell me this long sentence.
You don't find a lot of person that speak English. But So when I do find a patient that speaks English, usually I'm the one that's shocked, and it's nice. But I have learned to try to use the words I did learn in Italian to either let them know I don't speak good Italian, but also the words I do know to make sure I can communicate with them. And you stay here for these 3 months, and you stay in the studio, but you travel around Garfagnana.
Yes.
Do you remember something to like?
Yes, the area, I traveled outside the area, but this area in particular, we loved the mountains, going up to San Pellegrino, going into town. Just even when I had my 4-minute commute to work and I would walk, just the local area is very authentic. It's beautiful here, and this entire area I could live here.
Do you like to eat here?
Oh, I love it here. I absolutely love this area.
What do you think the American come here in Garfagnana must see?
I think if an American was to come to Garfagnana, they need to bring their hiking shoes and their hiking gear, and they need to go out and see the mountains. I think there's a lot of outdoor stuff to do here, and I think that is something that they should go and see because the views here are beautiful. And then even if you drive 40 minutes, you can see the sea. And so I think that if an American comes here, they need to be able to travel and go around.
I don't ask you why you choose Garfagnana. When you choose Garfagnana?
So I wasn't able to choose it. My instructor assigned me here. When I first found out that this was where I was coming, I looked it up and I said, this is perfect because I don't like the big cities. So this is the perfect area for me.
Don't explain why you are here. We must thanks to Edu Global.
Yes.
Yeah. Or Linda in particular.
Yes.
Because this project is possible thanks to Edu Global.
Correct. They're the ones that partner with my school to set all of this up. So. Yes.
What you will take back to your friends and share with them?
I'm going to share a lot with them, not only about the area which we just talked about, but also the clinic here and the different approach that Italy has towards physiotherapy versus what we have in the States. I think here it's very personable and it's more of a one-on-one connection. Yes, sometimes there's more than one patient, but everyone here does a really amazing job at making sure that each patient feels like they're the number one person that's being treated.
Okay. We talk about the Garfagnana and return to talk about the work. Which are the main difference between the physiotherapy in Italy and in Garfagnana and in the USA?
So the biggest difference that I've noticed, again, just from the clinics I've seen both in Italy and in the States, is here there's more physical therapists here versus in the States you have a physical therapist assistant or a physical therapist technician.
Okay.
So there's different levels.
There are two different type of work.
Correct. So the physical therapist normally in the States will only do an evaluation and a documentation, whereas the physical therapist assistants or technicians will do the gym, the exercise, the modalities, the manual therapy.
You have the instrumental therapy in USA, or you use you see Tegar, laser, shockwave?
Some clinics do have stuff like that and some don't. It's honestly really dependent on the physical therapist that runs the clinic or the company that runs the clinic. So here we definitely saw a lot more. While I was here, you saw that I would be looking up different things on PubMed and journal articles that help support the modalities and why they're useful in physical therapy.
Because the idea of the USA physiotherapy is oriented much more on the EBM.
Correct.
So in the instrumental therapy there isn't a lot of EBM, but you have instrumental therapy.
Yes, some will do it and some won't because they want to make sure that they are doing either manual therapy or exercise, and they also have a lot of patients that they see, and so they kind of don't want to spend time on that, so they spend time on other stuff. But I think that it's coming out that while there's not a lot about evidence-based practice with those modalities, there's still a place for them in physical therapy.
You say to me that you like much more the neurological part of rehabilitation, and I hope that during 3 months you love some orthopedic therapy.
I do. It's funny because when I was picking out my rotations, I told my classmates, I said, I do not like orthopedics. I don't want to do an orthopedic clinic, but it was required. And I was like, I know I'm not going to like it. And I come here and I'm actually very interested in it. I think there's a lot of room for research, a lot of room to learn new techniques in manual or to expand on stuff in the gym. And so there is a little space in my heart for orthopedics thanks to this clinic.
And I hope you do some chiropractic technique
yes.
when you return with your
will.
friend.
Yeah. Yes, I will.
And if you can use 3 words for describe this period, how words do you think?
3 words. I would probably say absolutely unbelievably beautiful.
Okay.
The area, the people, the clinic, it was amazing.
Thank you, Makayla.
Yes, thank you.
Good luck.
Thank you so much.